Okay, so today's video is probably not the thing I know the most about. Okay, so that's pretty it's pretty confidence building right there. But it's women's hormones. Okay, maybe I don't understand them all the time, but I've learned a lot about them lately. So we've been doing the breast scans. So we're doing the thermography, and we got a lot of breast scans that we've been doing. And one of the common things that we see is that a lot of women are having fibrocystic breast change. And so I started looking into what is fibrocystic breast change, what's causing this, and really long story short is it's being caused by too much estrogen. So we have an estrogen dominance, and estrogen dominance is a huge problem, okay? So what I'm gonna go through today is I'm gonna go through what are the women's hormones, what are the three primary women's hormones, how can you know, how do you test for this? Do you do blood testing, do you saliva testing, and then, exactly what type of dosage should I take, what kind of supplement should I take to offset the effects of this? So I did just get done reading a really good book. This is Dr. John Lee's Hormone Balancing Made Simple. This helped me out. Like I said, I'm still trying to understand, exactly, how women tick and everything. So, but that's okay. This really helped out a lot. This is a really good book, if you want to read one. And it's pretty much made simple, but I'm going to give you the cliff notes of it right now. The biggest thing is there's three different hormones that a woman is going to have. You're going to have estrogen, progesterone, and testosterone. The problem is that if your estrogen is too high, that's going to put you at an elevated risk for cancer, for stroke, for fatigue and headaches and fibrocystic breast change, for tenderness in your breast. It's going to put you at increased risk of fat gain. I know most women don't want fat gain, and if you have too much estrogen, the fat gain is actually going to come around that midsection. So it's going to be in the thighs, the butt, the stomach area around there. So that's a sign too that you're estrogen dominant. Okay, and so we want to make sure that the only way to pull that estrogen down is to make sure that you have proper amounts of progesterone. Okay, so estrogen is the first hormone. That's the one that most women are going to have too much of. Okay, your ovaries, your adrenal glands make a little bit of estrogen, but it's primarily your ovaries that make this. Even if you've had a hysterectomy or you are postmenopausal, understand that you're still going to make 60 to 65% of that estrogen from adrenal glands. Your fat cells still make it, so you may not even be low on estrogen. That's why you always want to make sure that this does get tested. And I'll go through which way is the better testing method here in just a second, which was new news to me, okay? Because I actually thought it was something different than it is, but always learning. That's the good thing, is that we're always learning. So you have the estrogen. We know we want to lower that. So the second thing is progesterone. So progesterone, once again, it's made by the ovaries. It's a steroid hormone. It's made when you ovulate. So we want progesterone to go up, because most women, when you get your hormones tested, you're going to be low in progesterone. So really finding it's like this teeter-totter where if I've got progesterone, or I'm sorry, if I've got estrogen up here, progesterone down here, I need to swing that. Okay, and the only way to swing that is to pull the progesterone up, lower the estrogen. Testosterone is another hormone that women have. That's for your libido, sex drive, that kind of thing. So you can get your testosterone tested as well. One quick thing on testosterone. Most women don't have to take like a heavy hitting dose of testosterone, but what I would do is you could take 10 to 12 milligrams of DHEA. And so DHEA is a natural precursor to testosterone, so that will work for women too, is just to take DHEA if you are low on testosterone. So how do you test for it? How do you know if you're low on testosterone, if you got too much estrogen, not enough progesterone, or how do you know these things? So is it blood testing or saliva testing? That's really the two basic options here. And saliva testing is actually, which is good news, you don't have to have a prescription to go do it. It's less invasive. You're going to see more bioavailability with saliva testing. It's a lot less expensive as well. So saliva testing is how you're going to want to figure out where your hormones are balanced or not. Okay, that's something that shortly we will be offering as well. So you can get saliva testing up here. You could go to any lab test. There's different places to get the saliva testing, but I always thought it was going to be blood testing that you would get. So, but not for hormones and neurotransmitters. Saliva testing is going to be better. Okay. So I've had the saliva testing. Now I know my hormones are jacked up, right? They're not where they should be. So now what do I do? Now, so if you're estrogen dominant, which a lot of women are gonna be, and that's really who I'm talking to right now. So if you're estrogen dominant, you're gonna need to take a progesterone, okay? So you take a progesterone cream. We don't wanna take it orally, because if you take it orally, you're gonna lose about 95% of the progesterone as it goes through the GI tract. So they would have to give you 100 milligrams to get 5 milligrams you would absorb. So that's not a good ratio. So you're gonna have to take a whole lot less if you do it transdermally, which means it's just something, it's a cream that you rub on your skin. The one we use is this one. So let's see if I can pull that up there for you. Yep, so there we go. So Progest, this is one we use, is from Designs for Health. This is a great one. It's 20 milligrams, which is a really good dose for a premenopausal woman. So you use this, you can rub it on your arms, you can rub it on your thighs, your stomach, your feet, the back of your legs. You know, thin skin is best, and you want to change areas as you start to rub this on. So if I'm a woman and I find out I need to take progesterone cream, now I want you to understand this. Here's how we're going to cycle it. So if you are premenopausal, right? That means you're probably 50 years and younger, you haven't gone through menopause, you're still having normal periods, then you're gonna take this for 12 days. Okay, so you're gonna take it for 12 days of the month. You're gonna take it on day 12 of your cycle. So that means day 1, I start menstruating, or I start my period on day 1. So day 12, I'm gonna start taking the progesterone cream. So day 12, I start taking this, I stop taking it on the day of my period. So as soon as I start my period, I'm gonna stop taking this till day 12 again. So really half the month, you're gonna take this stuff. And this is gonna help start to level out the progesterone and the estrogen levels in your body, okay? If you're postmenopausal, you've had a hysterectomy, then you're gonna take it for 25 days of the month and take 5 days off. So really the easiest way to do this is gonna say the first 5 days of every month, I'm gonna take off. And then the next 25 days or 26 days, whatever it's gonna be, I'm gonna take the progesterone cream. So just cycle it that way. And that's for someone that's had a hysterectomy or that is postmenopausal, that no longer has a period. That's how you're gonna cycle through it. Okay, so hopefully that makes some sense on how you will do these things. Also, if you have fibrocystic breast changes in your body, a really good protocol for this is to make sure you're already taking vitamin D3. You want about 10,000 IUs. Most people are already taking a vitamin D3. So if you're watching this video, you're probably already into health and you're probably already taking some supplements. So vitamin D3, 10,000 IUs. Iodine, you want to take about 10 to 12 milligrams of iodine, and then the progesterone, okay? And the progesterone, by the way, we want to take 15, So we want to take 15 to 20 milligrams of progesterone if you're premenopausal, okay? If you're postmenopausal, you probably take about 10 to 12, okay, milligrams of progesterone. And these are just general guidelines, and those are gonna help you, but like if you're one of those people that's very analytical and want to be very specific on it, get your hormones tested, do some saliva testing, get them tested, and then take the progesterone, take the iodine, take whatever supplements you need to take, and then retest it and see if those levels are getting to where they need to be. And a lot of this can be determined by your symptoms too. So if you're having like very tender breasts, you may notice that as soon as you start taking the progesterone, that tenderness starts to go away. So then we're going to know you are taking the right amount of dose. Unless and like I said, you can still get very specific with getting the levels tested. So. All right, guys. So once again, that was the primary thing that I wanted you to understand, is that progesterone really needs to be taken to level out that estrogen level. I'm now an expert in women's hormones. Maybe don't understand everything about them yet, but I'm an expert in that now. So, all right, guys. God bless you. Have a wonderful evening, and God bless.